Hana Ali, do I regret quitting medicine? How I feel 7 years later.
I quit medicine 7 years ago, and a question that a lot of people ask is, do I regret quitting? The short answer is no, I do not regret quitting.
I can relate to that. Get that question a lot as well.
Other uni degrees, people usually start thinking about them like a year or two before they apply. But for medicine, it's really, really different. You honestly start thinking about this stuff when you're like 14. Some people even start when they're like 12. That's how insane it is. Because you need to get such good grades throughout high school to get to the point where you're getting good grades at like GCSE and A level. And you also need to do lots of different experiences and you need to do lots of things to try and make you stand out compared to other applicants. So you really do start off thinking about this stuff at a really young age. And it means that for me, at least, I just spent so much of that time studying.
So you have to keep in mind, she's in Europe, and there you go to med school right after high school. In the US, you go to college, and then you get to explore a little bit, try different majors, or I guess you're not really trying out different majors, you're trying out different classes before you decide on a major, and considering different career options before you dedicate to medicine. Those 4 years are your pre med years, and then you hopefully go to med school after that. So their 6 year program, which is like essentially college med school combined into 6 years, is the equivalent of what we have here in terms of BSMD, these combined dual degree programs, which is the exception, not the norm. 90+% of people go the traditional route, and a very small percent go on the combined path route. So it makes sense why having to study very hard in high school and get great grades makes sense.
Getting into medical school was my number one priority. I knew that I wanted to be a doctor, but bro, I was 14. Like, how would I know that? How can you know at 14 years old what you want to do for the next 52 years of your life? Like, that's just mind boggling to me that people that young have to make a decision of whether or not they want to go into medicine. Obviously, you have years in between where you can decide. You can change your mind. For the majority of us, we are thinking about it early on, though. So when people give you crap for wanting to change your career as a doctor or as a medical student, just think to yourself, like, who are you to say that a 14-year-old is able to make that judgment about what they want to do for the next 52 years of their life?
That's actually a really good point she makes. I think when you're younger, your understanding of the world is radically simplified such that you think there are like 10 professions out there, right? You're like doctor, lawyer, engineer, garbage truck driver. That was like my brother's aspirational job. Nothing against garbage truck drivers. We just thought it was hilarious when he was a kid. He's like, oh, I like machines. I like trucks. I want to become a garbage truck driver. Um, I guess nowadays, like influencer, you don't understand all the different options. I don't think most 10-year-olds or 14-year-olds understand the difference between being a physician versus an optometrist versus dentist versus a PA or an NP or a nurse, right? Maybe they understand doctor, nurse, and all the other ones are just kind of muddled somewhere in there. I want to go back to what she was talking about regarding pushing hard since she was very young to get into a good school. Now, I have a different story, a different background, and I did very well in school because I was just competitive. Like I still remember when I was in maybe second or third grade, my mom said, "Kevin, you don't always have to be number one," because I was like number two on a test, and I was like, "Damn it," or whatever second and third graders say. And I don't know, I'm just wired in that competitive nature way. And in high school, I regret this because I feel like I limited myself. I cared so much, as most adolescents do at that age range in high school. I cared so much about fitting in and being liked and how I came across to other people that I took pride in being the kid that was like a bit silly, a bit like high energy, was trying hard to like talk to girls and like get into fitness and like do all that stuff. And then when people found out that I was one of the top students, it was always a surprise. And I took pride in that. Oh, yeah, you guys don't know that secretly I'm a nerd, you know, and that I go home and I study hard and I like test taking and stuff like that. It was something I took pride of. And in hindsight, I think I limited myself because I didn't really focus on extracurriculars that much. I didn't focus on leaning into that intensity. I always wanted to come across in a certain way and say like, oh yeah, I don't need to do those other things. I just need to get some good grades and I want to go work out and hang out with my friends. And I don't know. And I remember we did this high school math competition and it was, I was like, yeah, I like math. Let me go to that. And of course, there must have been some kind of cognitive dissonance there. But I do this math competition, 10 students there that are all like really, you know, hardcore, studious kids. And then me, I clearly belong in a way, but also kind of don't belong in a way. And only three people pass, and I'm one of them. And the other two were really great students, and then some of the other ones that didn't pass were still like top tier students that went to Harvard and wherever else, but they didn't pass the first round. And I was like, dude, what if I applied myself harder? Would I have maybe gotten into entrepreneurship at a younger age? Would I have gone to a different university? Would I have had different opportunities? So like when I graduated from med school, I had all my med school tuition covered, but I still had college loans. And like, oh, maybe I would have had less loans. Like there's all these what ifs, which it's not super important to dwell on that. But for those who are watching who are younger, dude, just like lean into that energy, lean into that shit. Don't care what people think so much, which I know is easier said than done. I'm in my 30s now. It's easy to not give a fuck. But if I saw a little Kevin at like 16 years old right now, I tell him, dude, just own it, rock it.
With medicine, it's very much a conveyor belt of a career. You start and you basically know the entire trajectory of your career for the next 20, 30 years. Obviously, you can pick different specialities, but for the most part, you know what that's going to look like. So anyway, it took a lot of time and effort from my childhood to try and get into medical school. I worked my butt off in medical school. I managed to get through, I managed to graduate, but honestly, like, it just wasn't, it didn't feel right. A lot of people were saying to me, oh, it's just medical school, like you're not going to enjoy it. Wait until you do foundation training. Wait until you actually start working as a doctor. And there may have been some credit to that. And I may have been like, okay, you know what? I will wait because I hated it in third year, but people told me to just wait until the next year. So I waited until the next year. And then they told me to wait until the next year. So I did. But when I start going to hospital every single day, surrounded by all of these doctors from junior level to senior level, and mate, everyone, like, okay, not everyone, but people were miserable.
Ooh, good points here. Everyone was miserable. Keep in mind, you're at an academic institution and at one academic institution, right? People at that one institution might be miserable, and in that one specialty might be miserable. And you got to keep in mind that there are people that work at other practice settings, not just academia. They can be community, they can be private practice, depending on their relative priorities and however they want to live their lives. There's pros and cons to each, which we cover on the Med School Insiders channel. Watch that video linked below. And also different specialties have different levels of like grind and hustle and lifestyle balance, and then also level in training. So if someone is a trainee, they're a resident here in the US, which is forgetting the term in Europe or in the UK that they use. They're not going to be as happy versus when they are an attending, okay? So what is very important to do is, as a medical student or as a pre-med, if you're uncertain about medicine, the answer isn't necessarily just to wait another year. It might be. It's to really examine the lives of those attending physicians and those attending physicians in these specialties that you're most interested in, and also try to get some experience, if you're pre-med, shadowing, as a med student during your rotations, so you can figure out what that future looks like. Because if every single individual in every specialty you're considering and in each practice setting type doesn't have a lifestyle or a work type that you see yourself enjoying, then something is wrong, right? But keep in mind that different levels of training, the earlier, younger people are usually not going to be as happy and fulfilled. And I saw that pattern because I spoke to a lot of physicians myself over the years, a lot of these mentors and such. And I saw a very clear pattern that the older people, which might not have just been age, it might have just been level of training, those who are further along were usually happier. The fresh attendings right out, they're comparing themselves to their other 30-year-old friends who went into different careers. They already have their home and family and whatever. They feel behind. They feel some resentment. But you talk to those who are in their 40s, 50s, 60s, a lot of them had very positive things to say from my experience.
Of course, some of them loved what they were doing and some of them were passionate about it. But for the most part, a lot of people did not seem happy. And I just kind of felt like I don't want to be stuck in this thing where it's like, okay, just 2 more years, okay, just 3 more years, okay, this level has been hit, okay, the next level, okay, this milestone has been reached, okay, this next exam. It just felt like an endless stroll of like pain and unhappiness. I just really felt like I needed to try something else before I committed the rest of my life to medicine, because it felt like I would have to do that once I actually started.
Well, also focus on your internal state. So yeah, she's looking at others outside, but also reflecting internally. And I think that internal reflection is the more important piece. You're going to get some information from those around you. Again, looking at different specialties, different lifestyles, different practice settings, etc. But it's ultimately a question of how you feel about it, right? So a lot of people will say med school is going to be a miserable time of your life. I very much enjoyed it. And I actually enjoyed most of my med school years. I thought they were fantastic. I actually enjoyed them more than college, but that's more of because my college sucked rather than Um, anyways, but even within that, people have different favorite parts of training or different favorite parts of medicine. And that's why we have certain personality types being drawn to different types of specialties. And I personally loved the first 2 years. I had control of my time, was learning a lot. I loved my third year as well, especially on surgical rotations, et cetera, et cetera. And I have one buddy who is now an attending orthopedic surgeon, and he loves his life and he loves the job. And even residency was challenging hours wise, and he wasn't always the happiest during residency, but he's like, dude, I just love the actual practice of orthopedic surgery, and I know I got to endure this challenging time and put up with some sleepless nights here and there, but he very much is all about it. And if he overly focused on other people outside of himself, then that would have led him astray. So it's a matter of looking outward to be informed, but then you have to reflect inward to make that ultimate decision.
So anyway, I graduated and then I moved to Berlin and I started working with a health tech startup. And almost immediately, I felt a difference. Like I could tell from the way I felt going to sleep the night before, having to go to work the next day. I would go to sleep and I would literally be like dreading going into hospital so much when I was in medicine that there were times where I would genuinely wish that I would get injured on my way or like fall ill and become sick just so I wouldn't have to go in. I feel like that's quite a common experience for people who really hate their jobs. In contrast, I have never felt that way once starting my other roles, like my other positions.
Yeah, that's a big sign right there. If you hate it that much, that's a really big, strong signal this might not be the right path for you, or maybe it's the wrong rotation, or it depends on how long that's happening and why it's happening and where it's happening. But that's definitely a big reason to be like, okay, press on the brakes, let's assess here, let's figure out what's going on, and then make an informed decision.
I remember just honestly being so excited to go to sleep so that I could wake up the next day and then go and work with my team and work on things that I really love doing. And it was that stark difference between what I felt in medicine versus what I felt in health tech or in other careers. I couldn't even compare the two because I just felt so majorly different. And I had never felt that in my life, where I felt so excited to go into work the next day that I was like itching to go to sleep. It sounds so lame, but until you have found that thing that you just love doing, it's really hard to understand.
That is exactly where we can all hope and dream to arrive at that. And I actually felt that about medicine, right? I left medicine, but I felt that about plastic surgery. I felt that actually about a couple different surgical specialties where I was like, dude, come on, man, hurry up. Like, the sooner you sleep, the sooner you can wake up, and the sooner you can go and do this case that you've been really looking forward to. And that's a great sign that you're on the right path.
All I knew was medicine was pain in one way or another. Obviously, there are amazing aspects of it, and obviously, some people don't feel that way. Some people love going into it. I'm just speaking from my own personal experience. Sometimes I do think to myself, I wonder, like, I try and envisage how I would have felt if I stayed in medicine. I don't know if I would say I miss it. I just feel like there are aspects of it that were really nice. I really enjoyed speaking to patients. I loved the idea of being able to help people, heal them from ailments and disease. I don't know why I said it like that. In any case, there were definitely things that I enjoyed about it, but to go as far as to say that I miss it would be miss it feels too strong. Regret feels way too strong because I do not regret it. I do wonder sometimes what my life would be like now. Maybe it would be easier. Maybe I wouldn't have hated it so much if I stuck out for another 15 years.
Yeah, considering how much she disliked it and how unhappy she was, I can't imagine that she would either miss it or regret it. I don't regret my decision, but I do miss plastic surgery, and I've maintained that since the beginning. Like, there are things that I miss, but you can miss something without regretting it, because missing something is like, I miss working with my hands. I feel like it's something that I enjoyed doing ever since I was a kid, and I practiced it a lot, and I took a lot of pride in it. And in plastic surgery, I was able to put that to good use. And I kept working on improving my dexterity and my surgical skills. And you can actually watch some of those videos on how you can advance those skills further and then impress your attendings and get better letters of recommendation and all that stuff on your ways and all that. But yeah, there are totally things that I miss. What you have to keep in mind is that there are going to be many different job options for any given individual in which you're going to have a pretty good life and you'll be happy. Like, I know for me, it's like doing this entrepreneurship thing is one. Being a Formula One race car driver would have been one if I ever was lucky enough for that to be a possibility realistically. which obviously it's not, and plastic surgery, right? Out of all three of those, I would totally take Formula One driver any day of the week. But between the other two, it's like, well, yeah, these both are really strong draws for different reasons. And you need to create your own list. And I'm sure if I sat down and thought about it, my list would be much longer. Don't fall for the trap into thinking that you can only ever do one thing, one career with your life, and that has to be it. And you can't change your mind, and you can't deviate, and you can't adjust or adapt, and you can't, course correct if something doesn't work out in that intended path. It's gonna be all right.
Because I do not regret it. I do wonder sometimes what my life would be like now. Maybe it would be easier. Maybe I wouldn't have hated it so much if I stuck out for another 15 years. But even then, I'm like, that whole 15 years is time that I could have used to do other things.
Wait, what specialties require 15 years? I guess if you count the 6 years of their med school. But no, she graduated, right? So then 15 years after graduating, I don't know. I'm not as familiar, obviously, with the specialization process in Europe. I know that certain specialties are longer than what we have in the U.S.
I know people say to themselves, oh yeah, just wait until you get to this level or this level, it calms down, it becomes so much easier. I want to live life in those 10, 15 years. Like, that's my youth. I've already given up my childhood. I don't want to give up my youth for something that makes me miserable.
You don't have to give up, definitely not your youth. And you don't have to give up your 20s and 30s either. So there are many people who get through medical training and they're not slackers, right? They're working hard. They're going to be great physicians and they're going to have their choice of specialty. And they don't feel like they're sacrificing their entire 20s and 30s because they're approaching life with a lot more intention and saying, okay, during this time after taking step one, I'm going to go on a small little vacation here. I'm going to, there's ways to have these little pockets of peak experiences that makes your life feel balanced. And if you're the personality type that likes the intensity and likes pushing yourself and likes seeing how much you can learn and push your limits and all that stuff, then medical school gives you that, right? So it's about your framing. And for certain people, that's absolutely not the path they want to take. I know some people very close to me who I know they would absolutely hate that and they would say, year one, I'm out. And if you feel like that, that's totally fine. What I'm trying to do here is just add the perspective that this isn't a universal truth that medical school and residency are going to be absolutely miserable and it's going to be no life and you're giving up your 20s and 30s. I just want to add a little bit of nuance here and speak to the gray area because I'm not disagreeing with Hana. I'm just saying that it depends on your school. It depends on your personality. It depends on your values. It depends on how you want to approach life. And I think that for myself and for many of my friends as well, pushing hard in med school was fun. And there were still shenanigans. There were still trips to Vegas and a lot of great, fun, rowdy memories. But there was also a pleasure to be had in just working hard and pushing your limits.
Versus the 7 years that I've had now doing all these amazing different roles, some of which have been really hard. It has been stressful. Don't get me wrong. I have almost been burnt out, if not been burnt out in a couple of those roles. It hasn't been easy whatsoever, but it feels different. I feel fulfilled, excited, motivated, curious, happy, open to opportunities, all these things that I just never felt in medicine. It just felt like such a weight lifted off my shoulder when I decided to leave.
That is such a good indicator that you're on the right path. If you feel all those things, hell yeah, happy for you, Hana.
Now I'm even panicking because I feel like I'm so old. Not I'm so old, but I'm running out of time to try out all these different careers. You know what? I really want to try out software engineering. I really want to try out UX design. I really want to do product design. I really want to do content creation. I really want to do this. It's almost like the excitement that was muffled out and I don't know, strangled in medicine was unleashed when I tried something new and I started discovering other things that I really, really love. It hasn't been easy having to explain my situation to people. Obviously, people are judgmental. Obviously, they make unkind comments or hurtful comments. A lot of them make you feel like, oh, you weren't good enough to stick it out. You weren't resilient enough. In any case, this isn't to say that you should leave if you are watching this video. It's just to share that there are options for people and I don't feel like it's the right thing to force yourself into a career that's making you miserable.
Yeah, that energizing feeling from your work, I think that's what we should all hope to one day find, and we should actively chase. And one thing that makes me feel that is entrepreneurship and the art of the start. You're starting new businesses, new possibilities, and even just advising for certain companies that I've invested in and such. It's exciting. It's like all the possibilities and all the skill sets that are converging, and you still, of course, build on those skill sets too. And I can still think back to my first ever case, third year med school, first time scrubbing up. I didn't even have the right shoes, and so I was wearing dress shoes in the operating room, and it was a latissimus dorsi animated lat transfer. And I talked about this in previous videos, but I just remember not using the bathroom for 7 hours. I was standing. I was so excited. I was so like, this is incredible. It was a joint plastic surgery, neurosurgery case. Called my mom right after as I was walking to the car, saying like, "Mom, I know what I'm going to do for the rest of my life." It's ironic, right? Because I changed my mind several years later, but that energizing factor is what I hope everyone can experience with their career, whether that's in medicine or outside of medicine, like Hana has found.
If you're staying in it because you truly believe that in a couple of years things will get better for you, or that if you make some changes in your environment or whatever, then it will get better, then absolutely stay, because I don't want more doctors to leave the profession. We need more doctors. Please, let's all try and like make medicine better than it is currently.
It's always funny to me the different types of hater comments that cluster on different personality types that leave medicine. I think for me it was the ones that I've seen were like I was stupid for doing so, or I was focused on money and I felt like I could make more money outside of plastic surgery. And for Hana, it sounds like it was resilience. At the end of the day, people are gonna feel challenged if you made a life decision that challenges their own value system. And if they idolize medicine and you left medicine, then it can't be that medicine isn't the greatest thing ever. It must be that you're wrong and there's something wrong with you. And that's just them reacting.
And I, in the end, ended up feeling like I could do way better things for the world and for my community and for other people and my friends and my family if I'm not miserable all the time. Whatever reason you're choosing to stay, make sure it's the right one, because if you could be a happier, more effective person doing something else, maybe it's worth exploring that. Again, not saying quit and leave everything and then don't put any safety nets in place or don't assess your level of risk and just don't be crazy. Basically, you can check out other things to do in a sensible way. Like, I made sure that I could go back in if I wanted to. There have been other people I've known who, for example, left medicine. I have a friend who left completely for a year, realized she missed it, so she went back, but she went back part-time, and she built her business on the side and then did part-time work. I know a couple of people who've done that, who've left thinking that they hated it, tried something else, and then decided, oh, the solution is actually just to go part-time and do something else that I can be creative in, or that I can increase my income in, or whatever.
Very, very important point that Hana is speaking to here, which is that don't make rash decisions. Don't make decisions that are unnecessarily risky, such as, let's say you have in the US $200,000 of loans, $250,000 of student loans, and you decide to leave medicine without a good plan on how to pay those loans back, right? That would not be good. I do a lot of these calls with med students and residents and attending physicians, sometimes even all the way up to close to retirement. And we discuss their various paths. By the way, there is a video we created that talks about some of these paths if you don't want to practice clinical medicine. And we go over the pros and cons. And one thing that we always focus on is capping the downside risk. You know, it sounds easy to like, oh yeah, I'm just going to go start a business. Like, well, hold on. Like, is the business already running? What are the chances it's going to be successful? Is it already proven, or is this something you want to start in the future? And based on those other career paths, no career is perfect. Do you understand the downside risks? Do you understand the possible upsides? And let's say it's not a business. Let's say it's an alternate career path. A lot of us will understand the upsides of that alternate career path. But do you understand the downsides? Because no career is perfect and every single career option is going to have some downsides, some costs.
So that's definitely something that I've seen happen quite a few times. But as for people who really didn't enjoy the profession and then decided to leave, did they regret? I personally haven't come across that. But again, I only know a handful of people who've done that because obviously not many doctors leave the profession to begin with. I came back in to record quickly because I want to say, by the way, that all of this is based on privilege. The amount of privilege I have to be able to just quit and then go to Berlin and do something else is insane.
That's a good balance. And also the optionality of being able to go back for a lot of people is a huge, huge, huge benefit.
So many people do not have that level of privilege. And I just wanted to take a moment to acknowledge that, and also to acknowledge that our generation does have the luxury to do these things, as in my parents' generation didn't really have that luxury. Like my parents, especially as immigrants, were focused on survival. They weren't focused on self-actualization and like picking the most fun, best career for themselves.
Yeah, going part-time and then doing something else is going to be a solution for a decent number of people. And that makes a lot of sense because a lot of times it's the demands of that full-time work that are challenging on a regular, normal human schedule. And I like that Hana is emphasizing the importance of the optionality of going back. If you have that optionality, right? Like there are a lot of med students who want to quit year 3. I'm like, dude, are you able to go another year? Because the optionality of having an MD, even if you don't pursue a residency, just by having an MD that already opens up many more doors versus saying you did 3 out of 4 years of med school, which essentially you might as well have not done any med school in the marketplace at least, versus having your MD after your name.
This is all based off of privilege, and I 100% acknowledge that. I wouldn't have been able to try out a different path if it wasn't for my privilege, if it wasn't for people who were very ready to help me financially. Like my partner and my family were super, super supportive. It would have been way harder to try something else had I not had that support from them.
Although counterpoint to that, which is that if you are being financially responsible, then hopefully by the time you're 50 years old, you at least have a significant nest egg that you could go, you know, an extended period of time, at least several months, if not a few years without working, and then figure out something else in the meantime. So there is that counterpoint, but I very much agree with the point she's making.
And also, had I not had the safety to do that, there are countries in which, again, this is not an option. Like your only option is survival. And part of that is just sticking it out in the career that you think is going to be the best for you, or is going to provide you with the best opportunities in life, and your family with the best opportunities in life.
Hana, thank you. This is my favorite part of your video by far. This is such an important part that I think a lot of people skim overlook. I think a lot of people just take things for granted, right? And I think the generational part is very easy to understand by a lot of us because for a lot of us, you know, my parents immigrated to the USA, and I'm so grateful that I'm born and raised here versus in India. The opportunity is totally different. And then she also mentioned, and I kudos to this because I think it's hard for people to do this, and not enough people are open about this, is that she had financial help to then allow her to quit too. Because yes, that changes your risk assessment, your risk tolerance massively, right? Financially, that is a complete game changer. And I want you guys to understand that and acknowledge it and see it as a factor that can change the risk calculus. But I don't want you to feel like you can only do it if you have that backing. Okay, so for those who are less familiar with my story, I paid for my own college, my own med school, right? I took out some loans, but all of my med school tuition and most of my living expenses were covered by merit-based scholarship, just by, MCAT GPA. And then when I quit, I already had the Med School Insider's business and YouTube channel up to, I think, like 250K subs, maybe 300K subs, something like that. So there was already some momentum. So like to reduce my risk, I already had the YouTube channel. I already had the business model that I had done before in high school. I already had a tutoring business in high school, and I was going to use the Med School Insider's brand as leverage. So there's ways that I could reduce the risk. I am fortunate that I was able to crash with my mom, and I stayed there for a year. That was a huge leg up. Admittedly, it was a very uncomfortable and not happy time living situation-wise. And silver lining though, it gave me more fire to be like, dude, I need to get out of here. And that's a whole nother story that we don't have to get into. At the end of the day, it comes down to an equation of figuring out the pros and the cons, the upsides, the possible downsides of changing paths, or even staying on the same path, right? That's still part of the equation. And there are things you can do to stack it one way or another. Don't think that these are absolutes. Everything here is just a variable in that equation to help you decide which path is right for you.
So yeah, I needed to come back in and say that because I was just sitting there thinking to myself, we should never not acknowledge the privilege that we have, especially for people who do things that are uncommon. It's not common to leave medicine. And part of that is because not everyone can. Like it's not, once you have that career, if you have a family and that family relies on your income, it's not as easy as me leaving at 24 years old, however old I was after medical school.
Yeah, being at a younger age usually gives you a lot more optionality too because you have fewer responsibilities. The average 24-year-old is a lot less likely to have kids in modern day versus the average 34-year-old.
If I left when I was 50 years old and it meant that I had no income afterwards or whatever, and my husband left me or my wife left me, whatever, like there are consequences attached, obviously, to making big decisions later on in life. Anyway, I felt it was important to say that.
Although counterpoint to that, which is that if you are being financially responsible, then hopefully by the time you're 50 years old, you at least have a significant nest egg that you could go, you know, an extended period of time, at least several months, if not a few years without working, and then figure out something else in the meantime. So there is that counterpoint, but I very much agree with the point she's making.
I just want you to know that you definitely have options. It may not even look like you quitting your job and never doing medicine again. It may look like going part-time. There are so many more routes available to you than I think you have been told there are, because it took me a long time to explore and understand these routes.
Yeah, there are a ton of different avenues that you can pursue. And again, that full video explains all the various options based on different training paths, and I hope you enjoy it.